Welcome to this explainer. If you're contemplating a career in surgery, well, you're in exactly the right place. Today we're going to completely demystify this incredibly profound, multidimensional discipline. We're looking way beyond the operating room to understand the core, foundational principles that make a truly great surgeon.
So here is your map to mastery for this explainer. We've got 6 main pillars to hit today. 1. Art, science, and surgery. 2. The systemic metabolic response. 3. Diagnosing the acute abdomen. 4. The reconstructive ladder. 5. Precision and the blade. And 6. A lifetime of impact.
All right, let's jump right into Pillar 1, Art, Science, and Surgery, defining the discipline. So what does it truly mean to be a surgeon? We really have to challenge this common notion that surgery is just about, well, physical cutting or treating one single isolated organ. It's actually way more than that. It requires a much deeper level of artistry, science, and just a totally holistic understanding of the human body. It's this incredibly dynamic field that's built on universal principles, not just memorizing specific procedures.
The Greek root plastikos actually hits the nail on the head here, meaning surgery is fundamentally the elegant art and science of reshaping the tissues of the body to restore both form and function. And it's wild to think about, but this concept dates all the way back to 3000 BC in ancient India. It highlights that at its very core, surgery is about reconstruction, it's about healing, and really restoring a patient to their optimal state.
Moving on to Pillar 2, the systemic metabolic response, visualizing the invisible.
Look, before you ever pick up a scalpel, you absolutely must understand the invisible metabolic war that's raging inside a patient following an injury or surgery. Back in 1930, Sir David Cuthbertson brilliantly described this as the ebb and flow model. Basically, the body's metabolic response to injury evolves over time. First, you have the ebb phase. This lasts 24 to 48 hours, and the patient is basically in shock. The body is desperately trying to conserve blood volume and energy, so it lowers the basal metabolic rate. But then, as the body kicks into repair mode, it shifts gears into the flow phase. This lasts about 3 to 10 days and is intensely catabolic. Energy stores are aggressively mobilized, and the metabolic rate just absolutely skyrockets.
You can see how this metabolic response forms a graded timeline. It requires some profound physiological knowledge to manage a patient from the exact moment of injury through weeks of recovery. After that highly catabolic flow phase we just talked about, the patient eventually enters the recovery or anabolic phase, which can last up to 60 days. This is where lost tissue is finally replaced and built back up. As a surgeon, understanding this massive reprioritization of energy, from that initial shock to intense hypermetabolism and eventually to anabolism, that is literally what keeps your patient alive in those critical days after an operation.
Let's hit Pillar 3, Diagnosing the Acute Abdomen, the Detective's Toolkit.
When you're dealing with an acute abdomen, you're essentially acting as a detective in the ER. You have to rapidly fire through these key signs and diagnostic tools to find the culprit way before the blade ever touches the skin. Patient has a sudden onset of pain within seconds? Well, that heavily suggests a perforation or rupture. You'll immediately want to order plain abdominal x-rays, checking both upright and supine, looking closely for free intraperitoneal air. You'll be checking labs for metabolic acidosis or leukocytosis, right? Because those can indicate serious inflammation or ischemia. And you'll use imaging like ultrasound, hunting for specific clues like a target sign or a pseudo-kidney sign. These are highly accurate markers for certain intestinal conditions, especially in kids. It is a rapid, high-stakes investigation every single time.
Moving right along to Pillar 4, the reconstructive ladder, building the strategy.
What's so fascinating here is how surgical repair is framed as this highly logical, step-by-step game of escalating complexity. This is the reconstructive ladder. It beautifully represents the strategic logic that, hey, the simplest approach to wound closure is often the best one. The goal is always to maximize success while minimizing risk to the patient.
So a master surgeon will systematically step up this ladder to solve complex wounds. You always start at the bottom. Can this heal by secondary intention? If not, okay, can we do a direct closure? Now, if the defect is just too large, we step up to a skin graft. If we need bulk or better blood supply, we step up again to local tissue transfer. And at the very top, for the absolute most complex reconstructions, we perform distant or free tissue transfer. That's moving tissue and blood vessels from one part of the body to another using microsurgery. Honestly, it's just a beautifully structured approach to problem solving.
All right, Pillar 5, Precision and the Blade, the weight of the tools.
You know, you step into an incredible lineage when you hold a surgical instrument. The metallurgical durability of these tools goes back millennia. We're talking an evolution from the very first procedures in 3000 BC to today's high-quality stainless steel instruments, which are made with chromium and vanadium alloys. Even ancient bronze surgical forceps and scissors were meticulously designed to resist physical stress. It's so similar to how modern instruments are forged today, to ensure that perfect springiness, edge durability, and, of course, resistance to corrosion.
Now, modern operating rooms demand exact ergonomics. How you hold that metal matters immensely. On one hand, we have the table knife grip. You'll often use this with a blade 15, which is kind of the workhorse for routine skin incisions. With this grip, your index finger guides the blade, allowing you to draw along its whole length. But then, on the other hand, for finer dissection, we switch to the pen grip. This is often used with a blade 10. Here, you actually steady your hand by using your little finger as a fulcrum. It's literally a dance of millimeters, and it requires immense physical discipline.
And finally, Pillar 6, a lifetime of impact. From newborns to geriatrics. All of these principles we've discussed, the metabolic understanding, the diagnostic intuition, the strategic ladder, and that physical precision, they all serve one single purpose. Because surgery is based on those universal principles of tissue reshaping, its incredible diversity allows you to change lives in a way very few other professions can. As the saying goes, you are dealing with problems from the top of the head to the tip of the toes. You have the capacity to intervene and alter the entire course of a life, ranging from a newborn suffering from a congenital anomaly all the way to a geriatric patient facing complex trauma.
So, understanding all these pillars leaves us with a final, pretty provocative thought to wrap up this explainer. Knowing the immense physiological knowledge required, the strategic rigor of the reconstructive ladder, and the absolute physical perfection demanded by the blade, do you have the intellectual depth, clinical intuition, and precise hands to step up to the operating table and make this lifetime of impact? Something to think about. Thanks so much for exploring this fascinating discipline with me today.